Well, hello, and thanks for joining us. My name is Rebecca Fincher, and I'm the Chief Administrative Officer here at Conway Regional. And today, I'm delighted to have with us Dr. Alan Lucas. Dr. Lucas, thanks for being here with us.
My pleasure.
Dr. Lucas is a pediatrician here on staff at Conway Regional and a well-known reputation here in the community. So, Dr. Lucas, why don't you just go ahead and start by telling us a little bit about yourself?
Very good. I've been at Conway Regional for almost 25 years now after a short stint at Little Rock. I practice general pediatrics with interest in asthma care, nursery care, and sleep disorders. So some infectious disease which we all take care of. But I'm glad to be here today to hopefully answer some questions about coronavirus and return to school.
That's exactly right. So we are here today. These videos are primarily for social media, and today we're here to talk about returning to school and how COVID is going to impact that. And so I know my child isn't school aged yet, but I know that there are lots of parents out there with lots of questions. So we may put Dr. Lucas through the ringer today with several of our questions. So first, Dr. Lucas, just maybe begin by telling us a little bit about COVID-19 and pediatrics and how that all works together.
I'll be glad to. Coronavirus, as you know, was only known in respiratory infections for the past 10 years. This coronavirus that popped up in China in January and then in the United States in early March is a new strain called a novel strain. So it's a new area to all of us. The first cases, of course, seem to involve adults more so than kids, so the pediatric population probably has lagged somewhat behind. Our personal experience here in town is that we have seen several, not a large number, of positive tests, but at this point, none of our pediatric patients have had great symptoms, or if they did, they were very minimally symptomatic. So a lot of ours is based upon what's happened around the nation. Nationwide, it's of course felt that the pediatric population is not as at risk as the adult population, or certainly those with underlying medical conditions. But certainly there are cases where pediatric patients are affected, and the latest thing, of course, is post-coronavirus or COVID-19, some of the cases of what's called a multi-system inflammatory syndrome are popping up, which is similar in pediatrics to what we used to refer to as Kawasaki syndrome. So it can have very serious effects, including affect the heart, affect the neurological system, or other things. But symptoms that occur in the pediatric patient vary tremendously from flu-type symptoms with fever, aches, pains. Remember, originally one of the first things they suggested to screen for coronavirus was respiratory symptoms, particularly respiratory difficulty. Since then, it has been shown up that some people may have conjunctivitis or pink eye. They may have a sore throat, and as you can imagine, we see those every day, and especially during the winter. Some even now have been reported to have diarrhea. So there's certainly a wide variety of symptoms that the kids may present with, and we've looked for those. We've screened numerous kids, some positive. Most of our positives have been through exposure to a family member or in a daycare or things, and when we look at those and follow those, most so far have been relatively asymptomatic.
So with that understanding of how COVID-19 can impact pediatric patients, as we start to talk about returning to school, recently the Academy for Pediatrics came out and said that it's best for children to attend school in person. And so I know there are different schools of thought on that. And so can you maybe just shed some light and provide a little bit of your opinion there?
Absolutely. I think what we've seen without a doubt since March, when the schools were closed, is a lot of kids and a lot of parents having great difficulties from their anxiety, depression was increased, they couldn't spend time with their friends. It has to be tremendously hard for a parent to work, either at home or at their job, babysit and educate their children. So I think everybody is strongly in favor of the return to school, assuming that safety is taken care of. And that's where you hear a little bit of the controversy. Is it considered safe? As you and I talked about earlier, the Arkansas chapter of the Academy of Pediatrics had a little different spin on that they presented to Governor Hutchinson, and that was that they thought they would not recommend at this time in-person schooling because they liked the phase 2 criterion, which had to do with a decrease in the number of cases over a 2-week period before that return to school was. The upsides of going to school are better socialization. I think their learning experience is better. I think they get to ideally play sports and do all the things that physically and mentally help them. whereas the downsides are just the unknowns about what is the risk of exposure once a group of 4-year-olds, 10-year-olds get back together, and I'm not sure they can all socially distance or that they will all wear their mask as been suggested. So there are some downsides that we don't know. I use the term, as Dr. Fauci does, the situation is fluid. And we thought certain things back in March or April that now we know better, and so they've changed the recommendations for care and exposure regarding those kids.
So as we talk about sending our children back to school, what are some things that children and parents can do to minimize their risk as it relates to coronavirus?
That's a great question, and I think a lot of it is just common sense for pediatric illnesses. If your child has respiratory symptoms, vomiting or diarrhea or fever, don't send them to school thinking this may be mild. Think about the possibility of coronavirus. We think it's going to be a hard task for our pediatricians in the fall to differentiate what may be allergies for the fall, maybe a sore throat, maybe just a common respiratory virus versus coronavirus, because those symptoms overlap. So that a parent should certainly watch for fever, respiratory symptoms, vomiting, diarrhea, anything aches, muscle aches like would go with flu. Those should be things that they should contact their healthcare provider and ask, what should I do? One of our plans for the fall is to obtain a machine that we can do testing in the laboratory in 15 minutes that will help us differentiate coronavirus from influenza and possibly from strep, so that may make that decision quick, as opposed to have to wait 3 or 4 days for the result of that test.
I know as a parent, structure is so crucial to the health and well-being of a child, but also just for your day-to-day. And so as you kind of go through the signs and symptoms of coronavirus, is there anything specific that you would recommend as far as parents should do every single morning when they're thinking about taking their child to school, or is it just regular ongoing monitoring? How would you kind of just advise a parent to think about that?
I think it's regular ongoing monitoring. I think they look for those symptoms that would suggest any type of illness, because as we know, common illnesses are going to be much more common unless things change dramatically in our pediatric population. But certainly instill in them, before they go to school and at school, the things that we've talked about. Good hand washing. If you sneeze into your elbow or cough into your elbow. Don't share food and drinks with your classmates. Hopefully maintain social distancing. The things that we always hear the infectious disease experts talk about. Mask, wearing of mask. And while we're talking about mask, there's a little difference in opinion between the Academy of Pediatrics at the national level and the Arkansas chapter. The Arkansas chapter recommends from kindergarten through 12th grade, with consideration for the 3 and 4-year-olds to wear them as well. We don't expect kids under 2 to wear them because they may not be able to put them on themselves. They may not recognize if they are short of breath. So that I think certainly kindergarten and up, certainly in the public school area, is one of the best things we can do. Like we talked about originally, that was felt not to be preventative in terms of the spread, but maybe only a few were sick. But I think the evidence now is very suggestive and conclusive that it will help to decrease the spread of coronavirus.
So if a parent or a child thinks that their child is ill, what do you recommend that they do? What steps should they take?
First, call their provider, whether that's family physician or a pediatrician, nurse practitioner, or things. I like for everybody to have a primary care physician, not to go against like the urgent care centers, but I think it helps if you know that system to know and call and talk to a physician or their nurse and say, these are the symptoms my child has, what do you recommend I do? Because these are different times with the coronavirus, and again, with the start of school, as kids get together, we may be dealing with more cases of it and more concerned about the contagiousness.
So we've talked a lot about really good infection prevention guidelines, social distancing, wearing a mask, and all the things that we've kind of learned throughout COVID-19 that we need to be doing. One question that I think a lot of parents may have is the virus transmitted differently, or how is it transmitted between children to other children, adult to children? Generally speaking, you could just ask, how is it transmitted? But, when you start thinking about your child and being in a room with their teacher or with other kids, is there any information there you can kind of share with us that might be helpful?
I think there's limited information now because, again, the pediatric experience is not as great as the adult experience. I think in general we know that kids are vectors of viruses and spread those commonly throughout the school year. In this case, current information seems to indicate they're less likely to spread it child to child, or even child to teacher, child to adult. And I think that's also one of the rationale for feeling better about the kids going to school in person. And common sense approaches to not let your 6-year-old go to see grandmother in the nursing home, that's been in place all along. But if anything makes us feel better currently, it's probably less contagious from child to child or child to teacher than it is adult. Now, what about when you're 12th grade or other things? Treat them like adults. Follow the standard social distancing and other parameters that we talked about.
Earlier you mentioned that this situation is fluid and we've had to get a little bit comfortable, maybe being uncomfortable with not having the information. And so I know that can bring stress in and of itself. One thing that I know that as of late there's been a lot of talk about is the treatment for COVID-19. Right. Is there any information that you can kind of share with us, or just your opinion on the treatment for that and how pediatricians feel about that?
I think pediatricians pretty much defer to their adult colleagues and maybe adolescent medicine colleagues from there. I participate on a website where a lot of infectious disease and adult intensivists put their thoughts, because it is changing. And I think after their experience over the last 3 or 4 months, they are beginning to recognize there are some protocols. And of course, there are studies ongoing to see what is the best. Early on, remember, people were quickly placed on ventilators. I think now evidence indicates the longer you can wait before you place a person on the ventilator, the better their chances are. So they're gathering and accumulating a lot of important data that's leading to better outcomes, shorter intensive care stays, and all of those things. It hasn't really hit the pediatric population, and even I think at Children's Hospital, their case experience with real sick kids needing ventilation is limited. It seems like we talked about earlier, the multi-system inflammatory syndrome is the worst complication we've seen so far in pediatrics across the country.
So Dr. Lucas, we really appreciate you being here and sharing all this information with us. Is there anything that you would like to kind of leave our viewers with today? Just tidbits from you, any information you think you can share that would be helpful as parents kind of head into August and they kind of think about sending their kids back to school?
Yeah, I think it's certainly an individual decision. Each family has to weigh its reasons for wanting the child to go in person, or its risk factors if there are people who have chronic underlying medical illnesses, or if people are elderly in the family. So I think it's an individual decision. I get asked daily, what do you recommend? And I have to defer and say, right now we don't have a recommendation. You have to, as the member of the family, look at all your risk factors and decide what is best for you. Obviously, teachers love to see their students come in person, and I think that's historically how they feel comfortable. But they're also a little bit leery at the same time, because what is their risk of exposure of children to them that they may then take home to their families? And I think that's the unknown right now, is if the kids do begin to have increased cases, it may not be risky to them, but it may be risky to teacher or the child, the student who goes home where there's a grandparent in the home or an adult with diabetes. So I think we have to look at all of those factors, and especially as school starts, be willing to change our opinions or our strategies if the number of cases increases greatly.
Well, thank you so much, Dr. Lucas, for being here with us. Conway Regional has been in this community for nearly 100 years, and we will continue to serve as the community's resource, whether we're talking about COVID, preparing to go back to school, or whatever it may be. Thanks so much for being with us today.